We can begin. Iniciando. We are going. Let's get the party started.
Yay!
Hello, Planet Earth, and welcome to Facialteam's live streams. I'm Lilia. My pronouns are she, her, theys, and them. And today we are honored to have a special guest who will be chatting with us today about gender affirming. We are going. Let's get the party micropigmentation. Hello, Planet Earth, and welcome to Facialteam's live streams. Somebody's audio is on. Her, theys, and them. And today we are honored to have a special guest who. There we go, Lisa. If you could just check your audio there, and you have the video on playback, and I'm hearing myself. So I was just saying today we're honored to have Lisa here, and an expert in gender affirming micropigmentation for surgery scars. Hang on, Lisa. I'm just going to reactivate your mic. And I'm hearing myself. So I was just saying, yeah, I can still hear myself. So perhaps you have the audio output on a different device. Not sure. Maybe put in some headset. If you have any earphones, then that would be great. Otherwise, we're hearing myself twice.
Is it not because of me?
I can hear you fine, Nilce, and
Okay.
the audio is not coming back through your mic. It's coming back through Lisa's. So, Nilce, while Lisa is looking into that, thank you for coming.
Thank you for inviting me.
My pleasure. And I just like to say that viewers, we're also listening to the comments on YouTube itself. So please write your questions on the topic in the chat here on the side, and I will aim at getting those into the conversation today. Okay, so Nilce, could you tell us a little bit about where you work and how you collaborate with Lisa?
Yes, of course, Laila. I'm Neeltje and I'm working at the gender clinic in the VUMC, Amsterdam, in the Netherlands, as a doctor's assistant. And with one of my colleagues, we will see the patients who get mastectomy surgery afterwards to get a nipple tattoo in Amsterdam. And we are hoping to work with Lisa to get in the training program and to become angel of Lisa, the Le Fever angel. That's the plan, the meaning.
Fantastic. And so when you say to become a Lisa Le Fever angel,
Yes.
what does that mean? Can you explain what you're doing with Lisa?
Well, she has a training program, and so she can talk everything about the scars, the tattoos, and everything we need to know to become professional. That's what she can do for us.
Excellent. So you'll be able to offer the services in micropigmentation that through your own clinic, no? So Lisa, let's give it a go now. Will you activate your mic? Let's see if we can still hear you. The best thing would be to plug in some headphones if you can. That way there won't be any interference. Your mic is silenced at the moment, Lisa. Let's see. I'm going to talk a little bit and see if I can hear myself.
Can you hear me?
I can hear you.
Is it okay now, or have we gone off? No, it's not, is it?
I'm not sure. Did I just hear feedback? Lisa? Yeah. Do you have a headset, Lisa?
No, I don't hear.
Do you have any headphones? I'm going to talk a little bit and see if I can hear myself.
Can you hear me?
I can hear you.
Yeah. Is it okay now, or have we gone off? No, it's not, is it?
I'm not sure. Did I just hear feedback? Lisa?
We are completely we're
Do you have a
videoing.
headset, Lisa?
No, I don't hear.
Do you have any headphones? We're getting a lot of feedback there, Lisa, so it's not gonna be easy to do the live.
Are we gonna?
Maybe log off and log back in. See if it corrects itself. Sometimes that helps.
Okay,
And Neeltje and I can go forward and talk about the part that
okay.
pertains to her, okay?
Mhm.
Thanks, Lisa. Sorry, folks, we're having a little technical difficulties. And Lisa's going to step out for just 1 second, come back in. And in the meantime, Neeltje, would you tell me where the polyclinic is where you are working?
It's in Amsterdam, at the VUMC, the academical hospital in Amsterdam. And we have Kennis- en Zorgcentrum Gender Dysphorie. And there we see a lot of patients from whole Holland, all over the Netherlands.
Amazing. How long it's a gender clinic, no? Specializing in gender affirming healthcare?
I'm working there for 5 years now, but they are a much longer time in the hospital. They started small, as a small polyclinic, and now they are very big with a large placement.
And what services does the polyclinic offer?
They offer a lot of services from the start of a communication with one of the psychologists, and then with the endocrinologue to get hormones, and afterwards the surgery and the aftercare. So it's the whole process. They will
The
offer.
entire process from start to finish. And so you said you've been there for 5 years and the clinic's been there for a while. So you've seen quite a few patients. And can you tell us what your experience is with some of the patients that have received the micropigmentation treatment for their scars after surgery?
I can see the patients are very happy because it's something visible, and it's a kind of improvement. So the patients are happy, and it's a final touch of the whole period.
Fantastic.
So we see a lot of happy patients. Yes.
And your own personal perspective, that you've seen the results of the micropigmentation, and Lisa, I think, is going to explain a little bit more what that's all about. But what is your perception of how this is able to help patients in terms of results?
For me or Lisa?
I'm here. You can hear me.
Yeah, it's working.
Thank God. Okay, so yeah.
Right. So I'm going to backtrack a little bit then now that we've got this going. Thank you so much, Neeltje, for stepping up and helping out while Lisa was sorting out that audio glitch. So Lisa, first I wanted you to talk about your passion for helping trans people and also people in trauma, and tell us a little bit about yourself.
Right. Well, I've been in the cosmetic industry for years, and unfortunately, appearance is quite important. And even though it's not the most important thing, a lot of people, really find the appearance, of a scar or of a tell, something quite traumatic sometimes. So I noticed there was a little leash in our field, and I thought, oh my God, well, really, I want to help people that have had traumas to, reduce the scarring, or somebody that's, been in transition and had surgical procedures. I started offering my service more and more to the gender community and the trans and trauma afdeling from the hospitals. And I noticed there was a sort of, gap in the market. So this is something that I could do to really, help people, whether it's, a small scar after a lip lift, or, somebody's had cancer in the face, and we can camouflage that. When you look in the mirror, you're not confronted every time with that operation or that event that happened. So it's sort of taken over my life, really. The yeah, it's just so important to me to help people and make people feel the most comfortable and happy that they possibly can. So yeah.
Oh, Mesa's here.
Yes, she is.
Hello, Mesa.
I don't know if she can hear. Hi, Mesa. Hi. I think she's at work.
She has a slightly slower signal, it seems. So Mesa is one of your clients.
Correct. Yeah.
Who came to you for this service.
Correct.
And I'm not sure what you're calling it, actually. What are you calling this?
Well,
now, before when we talked about microfeminization,
right.
that was more about permanent makeup, right? So what we're talking about now,
yeah, is scar improvement. So we actually, most of the time we use a combination of services. So scar improvement is where we all generally begin, to try and hide any scarring, after facial feminization or body, after transitioning. So we start there. The most important is to try and get that scar as less visible as possible. So to improve the skin condition, texture, size of the scar, improve on mobility, because we find quite a lot of the time, I think Masha had the problem behind her ear actually after some surgery that was very, very tight, the scarring. And once we've reduced the scarring, then we use the pigmentation. So and pigmentation can be anything really from doing our camouflage techniques to camouflage the scar, or on the face, micropigmentation, we say, microfeminization to feminize the facial features or masculize the facial features, depending, on what we need to do. So yeah, scar improvement and microfeminization or micromasculization, we call our services.
Fantastic. So I think Misa has lost her signal.
Oh.
But at least we got to meet her briefly. Perhaps she'll pop back in, and as soon as she does, I'll be sure to ask her some questions, because we definitely want to try and hear what she has to say about her experience with the combination of micro needling and and dermal pigmentation. No?
Yeah.
So, we were talking about the polyclinic and the Lefevre Angels training program, which Nilce is a part of now. You're collaborating. So we hope to, right. So, and Nilce was telling me what the clinic offers, the whole sort of array of services within the hospital there in Amsterdam. So can you tell us, Lisa, what are the different areas of the face and body that can be improved with these services?
Okay, sure, of course. So really, from top to toe. So really, like I said, again, if it's facial feminization or masculization, there's a lot of scars, and that can't really be prevented, even though they may be small. They're still there. So there's still a tell. So we really want to reduce those scars. So from the hairline, like a nose lip, lip, hair scarring, the chest, the breast, the genitalia, we do a lot of scar revision on those areas. Hairline, we can actually improve the scars, but not only the scars, we can actually add some structure of like hair tattooing in there, because we see quite a lot of scarring, around the hairline or going, from ear to ear where the surgery is. So, and as you know, every person is a unique canvas. So we have lots of different scars to deal with. So every patient is unique. So
exactly.
Yeah.
So we're talking about hairline scars for some people who have had perhaps FFS through the hairline, or even through the crown scar, where people want to have a little more sensation of density there. Eyebrows, eyelash lines, lip lifts, you mentioned, trachea shape scars.
Absolutely.
The lips themselves. the areola, which is the nipple mastectomy scars. And this is the area I think that Nietzsche has more experience with, right? With clients of the polyclinic that have come for mastectomies, no? Or maybe even breast augmentation. Nietzsche, how do you see this benefiting your patients on a day-to-day basis?
You can see that the patients are more confident after they've been with us, with my colleague, and they have more happiness in life overall.
Yeah.
It's so visible.
Yeah.
Yes.
It's quite life-changing, isn't it?
Yes.
So
in terms of the nipple, just to explain for some of our viewers, what is the difference between a feminine and a masculine nipple anyways? Because a lot of people probably think our nipples are all the same.
No, for women, they are larger. For the men, they are smaller. That's the difference. And they are standing more aside for a woman. So that's the difference of the chest. Yeah.
Okay, thank you, Nietzsche, for explaining that. So, Lisa, you mentioned a little bit, you hinted at sort of, everybody's different. So that means expectations are all different as well. Can you tell us a little bit about how people should adjust their expectations in regards to your services?
Absolutely. It's our services, can be anything from 1 to 3 procedures to seeing a client for over a year. So, from the beginning, we have to be realistic what we can achieve. We can guarantee absolute improvements, but, to completely reduce a scar to nothing is very, very difficult. We can have maybe a 90% improvement, but the chances are you will have a very small, fine visibility left. So that's very, very important from the beginning to, to discuss with our clients, So I'm always happy if my clients underestimate a little bit and we overachieve. So their experience is much more pleasant, than if we promise the world and they're disappointed. So,
Nietzsche, what do you think about the expectations of patients that they usually is it difficult to make sure that they aren't expecting miracles?
A lot of patients expect miracles. It's hard you have to tell a lot. Yes. We cannot look like Barbies.
Right.
Yes. You have to talk a lot. Yes.
With the beauty sort of aesthetic, which is unrealistic really for most of us. People do not realize that the work that goes behind this and the capacity it has. So before we get into talking more about the time frames and the quantity of sessions and all the work that goes into something like reconstructing a nipple so that it's realistic and gender affirming, I think Maisa probably isn't coming back, it seems, because she was popping in for a work break and it was very brief. So I wonder if you could both tell us a little bit some of the concerns you hear clients talking about when considering having this kind of service.
Yeah. Did
you want to go first?
I'll go first. Yeah. Well, I usually see a lot of clients after surgery. So it's usually they don't come to me before surgery. So I'm usually discussing the areas that they're slightly unsatisfied or that can be improved. So we see.
Right. So I'm asking about the concerns they have about micropigmentation.
Most of the time there really isn't very many concerns about the procedure. They're more concerned about the results after. The one concern we do talk about is the color of the skin after a procedure, because we have a very unique set of guidelines for our procedures. We start with one method of microneedling. Immediately after, we use a laser. We use our Origin laser. So fantastic laser. And then after we use our pigmentation and our LED lamp. So it's a very, structured way of improving on scars. Now, every procedure has a different side effect, I would say. Let's say, so, after microneedling, the scar will become much more visible because you're implanting needles into the skin, and therefore you get little blood spatters, and the actual area can look much more inflamed, and it can be quite scary to start with.
Right.
So obviously you do not want to be going swimming, or being, visual. You want to hide your scars a little bit after the procedure for probably up to a week.
Okay.
After we do our laser. Now, the laser actually is a lot softer in reaction, so you have a little bit of redness for maybe, an hour after the procedure, so you can, get back to your normal activities. But the other concern that I hear a lot is really the time frame, because clients generally want as quickly as possible a solution, because we're talking about human beings and skin, and the natural ability of healing. I say really we do need to give this whole procedure at least a year, from begin to end, whether that's I'm only seeing you 3 times or 6 visits. Please give it a year for the whole healing process to take place. So that is something, that is sometimes a bit of a concern for clients, that it's not quick enough.
Okay, that's interesting. Yeah, it's good to know that, the concerns may include how long it's going to be before they can sort of get back to their normal social life. Neeltje, do you have anything to add to some of the concerns that are typical of the people that come to your clinic who are interested in this?
I don't hear a lot of concerns from our patients. They are so happy to come with one of my colleagues to get a tattoo. So they're happy.
Yeah.
And a kind of zen-like. With no
okay. But what about pain? Do they ask about pain?
Well, they feel the pain a little bit, but we will make a nice gesture to talk, and it's okay, I think.
Yeah.
Nobody runs away.
No.
And what kind of, are you using any sort of painkillers while you're doing the procedure? Like gels or anything like this? It's not necessary. It's not so painful then?
Well, personally, I find when working in the scars, it's not very painful because we're working on scar tissue. So the healthier the scar becomes, generally, the more painful it is, which is a good sign. So usually when I start out, there's minimum pain that we're, clients will, minimum. Yeah. I think most clients can really, again, like Neil, she said, everybody's just so happy that, to begin the cherry on the cake, so to speak, it's, everyone is usually over the moon.
Absolutely.
Grateful.
So talking about time frames and quantity of sessions, how long are we talking about for, let's say, the average lip lift or trachea shave scar, which are usually small and fine?
Yeah, really, the procedure will take me half an hour, really, half an hour. And the downtime, like I said, is can, for something so small, probably, maybe a day that you might have a little bit of redness, but then everything subsides very quickly. So it's a very quick procedure for something so so small. And most of the time with 3 or 4 procedures, we really have made a significant improvement.
Great. So that's pretty quick. How long do they need to leave in between? You said 3 or 4 sessions, what each session is about, let's say, an hour. And how long in between the sessions?
I would advise really a month, because sometimes I could do a little bit quicker, a little bit longer, but around 4 weeks is perfect. It gives the time for the skin to start going into healing process, and just before the skin really was the scars, the healing process slows down a little bit, then we're going to just again work on that scar to wake it up and start healing all over. So yeah, around about a month. But of course, sometimes our clients, that doesn't work for people because we have clients coming from all over Europe here for their scar treatment. So really sometimes we have to make the appointments a little bit further apart to suit the client's needs, which is absolutely fine. It does not hinder the treatment whatsoever. So
okay, that's good to know.
yeah, so if you know, it just means that it's going to just take longer.
Sure, for traveling purposes, and they can't come every month, so it takes a
Yeah.
little longer to finish the treatment and
Yeah.
until you get to optimal results. But
Exactly.
it could technically be done in 4 or 5 months.
Absolutely.
A small scar. Now the bigger scars, I understand, will take longer.
Yeah, it can take a lot longer, but also it depends. Again, everybody is an individual. Sometimes I am so gobsmacked how much of an improvement we can make on an individual, you know.
Right, some people have their skin responds better than others, right?
Exactly, but what is beneficial, trans females have much more collagen in their skin, so they usually get a better results than cis women, you know, from a scar, you know. So it really is, you know, so absolutely much more collagen, so you get
fantastic.
you get a quicker result. But there is something I would like to talk with Hiltje about, is where you now have your clients coming for their tattoos. We do something a little different. We work first on the scarring before our clients get tattoos. So the skin is really, you know, at its best possible condition before they get the tattoo applied.
Sure, like preparing the canvas. You have to prepare the canvas before doing the art.
Exactly. So that's something that I think Hiltje will be doing in the future. So I hope.
Yes.
Yeah, me too. Yeah,
that would be great. So Hiltje, I wanted to ask, and Lisa mentioned that people come from all over Europe, but I think the grand majority are Dutch patients. So I understand in Holland, a lot of the patients are able to get this kind of treatment, at least partially reimbursed by their health insurance. Is this correct? Are you working with insurers, with insurance companies, so that the client doesn't have to pay the complete cost of the treatment?
No, I think they covers all of it. Except your go, but yes, and maybe some medicines you have to pay a little bit more, but it's in the basis, in the basisverzekering. Yes.
Oh, that's fantastic. So they don't have to pay everything out of pocket.
No.
Oh, that's wonderful.
Yeah.
And so it's the situation in the Netherlands is amazing.
Yeah.
It's like a model for the world. Everybody is going to want to go live in the Netherlands now and get insurance in order to have the treatment. So I understand that the insurance for camouflage therapy, right? It's
correct,
registered as camouflage therapy, and as it's on the face many times, then it is covered by the Dutch insurance system.
And we also have, if it's not covered for any, you know, any reason, we offer most of our services for free for our clients. We would offer our services. So they would come, we would work on them, and I would use them in our training programs. So teaching other people to do these services. So it's a win-win for everyone. So
wow, that's very generous of you, Lisa.
Yeah, well, it helps everybody, doesn't it? So, you know, it helps me with my training program, helps the client, it helps the student. So everybody is really happy. So, you know, if there's ever a problem with insurance, this is how we personally solve, you know, the situation.
Okay. So, and I understand that Maisa was in a situation where she was able to pay for her treatment, no?
Yes.
And did she get her treatment covered by insurance?
She did, yes, she got partly, not everything, but partly. Absolutely.
Okay,
Yeah.
wonderful.
She actually didn't need very many procedures at all to in fact, later when we go through, if we're going to go through some of the pictures, there is actually a photograph of her scar, one of her scars, and I think we
Okay.
did 2 or 3 procedures for her, and actually it's non-visible now, her scarring. So it's really
Wow,
quite
that's
happy.
amazing.
Yeah.
That's
Yeah.
really good. Really
Yeah.
good, because it's certainly, Facialteam, for example, goes to great strides to make sure that any scarring is hidden either by hair or in a crease, etc.
Correct.
But there are times where, for example, a lip lift, the small scar that is left underneath the nose is still a tiny amount visible, no? Or the scar on the crown may be slightly seen for people who have thinner hair or lighter hair. And so these are elements that can be improved.
Yeah.
So that it's not a trade-off, of being more feminine and having scars. No, we want you to be more feminine and not have scars.
Correct.
So did you want to have a look at some of these photos then?
Sure. Yeah.
Yeah. Before I screen share, Nilce, did you want to add anything else to some of the topics we've been talking about? Do you want to tell us anything else, any more about the polyclinic or about the patient experience where you are?
Well, I think I said everything for now.
Okay.
Yes.
We're going to look at some of Lisa's photo examples. So if you need to get back to work, I completely understand.
Okay, I can take a while.
Okay.
Oh, that's nice.
Excellent. So I'm going to share the screen here. We've got some pictures to show everybody. You can see my screen here.
Yep.
Okay, so the first one here is this.
Okay, yeah, this is just we have 3 examples here. The first client is a gentleman that has alopecia, so hair loss. He's got alopecia frontalis, so he's lost his hair around his hairline and his eyebrows. So this is just a very, very simple example of, for a gentleman getting those, the hair, the eyebrows back. Now, our second client was actually, she had skin cancer in the face. She had it removed at quite a young age, and she had a skin graft. Now, we see this quite often. Now, this, I have to be fair, this lady was actually a model in one of our training programs. So this was actually done by a student of mine. Now, as you can see, first photograph, no makeup. Second photograph is tattooed, so she doesn't have to wear makeup anymore. So you can see really the eye is certainly not drawn to that scar tissue anymore. Is blended beautifully with the skin tones. Now, the third photograph that I'm showing you is a client. Now, she's just had a skin improvement with our Origin laser. So as you can see, we've taken years off of the appearance of the fine lines, the laxity of the skin. So, and this was just using our Origin laser. So I thought it was interesting to see the different things that we could, improve on. We go to the next photograph, I think, with the...
Sure, the next one.
Yeah.
There you
Okay, this again is skin cancer. We did a treatment plan with, I think we did 2 sessions of microneedling just to soften the edges. And then we did 2 camouflage sessions just to bring the blood farts, the little veins, and the different textures in the skin. So again, this is it's not visible anymore on the nose. It's blended. Nobody can see that scar. I think 4 sessions we were completely done here. So he was very, very happy. Okay, now this actually is a client that we are still working on, but we have reduced the scars, you know, well, as you can see, the color has improved so much more. The scars are actually even slightly better around the nipple area now, but this is still a work in process. So it was quite heavy scarring, but the scars feel so much softer to touch. But it is a work in process. You can see quite large scarring. Oh, I'm sorry for the condition of the second photograph here. This is a lady, actually, this was a client from Bridget Meyer. She actually sent this client to me. There was she had somebody threw a firework bomb through her letterbox.
Wow.
And, yeah, and it really was across her face and on her neck and her arm and her leg. And we've been working on the scarring across her face with a combination of microneedling. We did laser and we did camouflage. So I'm sorry for the condition of the photo. It's a little bit blurry on the big screen. Okay, here we did only laser. So you see that the scar is much softer and the client has much more mobility in the neck. This was something that was really, she had a really hard, heavy, thick scarring around her neck. So this is now much more suppler. She can move, much more comfortable, no more itching around the area. I think we did here. Yeah, this is again microneedling and a little bit of camouflage just underneath the breast area. Okay, and this one is, yeah, this actually was a dog bite. This was just 2 treatments of microneedling. You can see how the skin has improved. Yeah, and go on to the next. Okay, this is self-mutilation. Now we see a lot of customers as well, clients, patients that are referred to us that obviously have had that have injured themselves. We can really help here with microneedling and camouflage. We can't completely remove the appearance, but we can certainly reduce the appearance. Now, a lot of these clients generally will like to have a tattoo over their arms or wherever. Even if a client is intending to have a tattoo to cover these scarring, I would still recommend doing microneedling before you start implanting ink into the skin. So that's really a must. This was just 2 treatments of camouflage, a very simple treatment, lack of pigmentation, 2 treatments, very happy clients. Yeah. Okay, sorry for the blue circle, but this was after FFS. The scar around the hairline, we've reduced, I think, about 75% so far, the scar around the hairline by microneedling, laser. Again, we used our Origin laser and a little bit of pigmentation, but not very much pigmentation. We always try and improve the area with microneedling and laser before we even consider pigmentation. So yeah, she was very happy with this. Yeah. This is another bomb explosion, another lady from Bridget Meyer. So she was from the trauma ward. So horrendous. Somebody had actually a bomb. This was in Wormen in the Netherlands. And it was a criminal that actually got the wrong houseboat. So it was even a big mistake. This lady's got a glass eye. Her nose was in her forehead. She had so much work done on her face. Bridget did a fantastic job, sewing every part of the face back together. but you know, of course, there was much skin loss here. So Bridget, you know, had to, you know, bring the lip area back together. There's another photo later. And sew it together. So she had really minimal movement, around her mouth area. We've done many areas of laser and microneedling, but as you can see, the scar is reduced so much. Her movement, her mouth movement now is, she can eat normally without any problem. So this is a client that has been with me now, I think for, oh my gosh, 4 or 5 years. So she comes to see me about 3 times a year just to keep everything supple. But everything that we do, I have to note, is permanent. So the microneedling is permanent, but it doesn't stop working. So you can keep working over the scars. And I think clients feel very comfortable that they have a place, you know, to come back to and, you know, keep working, keep improving on that scar tissue. So yeah, this is
I hear the full face photo, you really get a sense. So.
Yeah, you really do. I mean, the scarring on the forehead is completely, I mean, non-visible anymore. And it was more for Monique, the movement of her face, you know, this was quite important. This is another skin cancer. Gentleman, of course, lost his eyebrow, so we gave him a new eyebrow, which he was very happy about. So again, back to the beginning. Okay, now this is one of my clients. Now she's ready for facial feminization. She was on the waiting list, but her eyebrows were very low, very masculine. So she really wanted to have some microfeminization done before her surgery. So we just lifted the shape of the eyebrows just to give a much more feminine appearance until such time that she was ready to undergo her FFS. Okay, yeah, this is, as you can see, this is surgery. Actually, Monique, Bridget Meyer did a lip lift. So the space is much shorter, but I created a much fuller lip shape. So
this is before, the one below is before, and the one above is after. Okay,
exactly. So we've worked on the scarring under the nose, so you can't actually see any scarring anymore.
Oh yeah, so
that the scarring is completely gone. We gave her a really full lip because she didn't have a full lip at all. So the combination of the 2 procedures is really, I think, you know, match made in heaven. Now this is Lisa, yeah, that I was talking about. We could see she had, you know, some scarring really.
Yeah, you can see the scar here.
Yeah,
just above her ear.
And actually now it's just not visible anymore, the scarring. It's I would say it's 95% disappeared.
Yeah, so, and the photo isn't very similar, but
no, yeah, I'm sorry, but it is a photo I took a couple of days ago, so it was in different light. It is definitely not tampered with. Yeah, this is really just microneedling again. We did the laser, the origin laser. Here we did 3 sessions and we got fantastic. So this, obviously, the scar on the top of the ear was not so visible because it was, you know, in the hairline, but she really did have a lot of problems. It felt very uncomfortable to her. You know, it was very pulley and there was not so much skin laxity there. So that was really good. We managed to achieve that.
Yeah, absolutely. Thank you for sharing those cases, Lisa. That's really helpful. And it's always good to explain the work that goes behind, what's happening. So, yeah. So did you have anything you want to add to what we're talking about today?
Well, I just wanted to, you know, talk a little bit about, we are starting up, you know, this world program. So it's our intentions to deeply train our students to learn these services, you know, scar improvement, camouflage, microfeminization, micromasculization. We're starting a community of angels So Lefevre angels that we hope to have around the world, offering these services for, you know, the gender community. So if there's anybody out there, you know, interested in getting more information, please don't hesitate to contact.
Fantastic.
Yeah.
Thank you so much again, Lisa. And
Welcome.
Nilce, did you have any takeaway message you'd like to leave with our viewers today?
Myself? Or
Nilce.
Nilce.
Oh, sorry, I did it in yes. Well, I hope to see more patients at the VU, at the gender clinic, to reduce the scars and to get a suitable nipple tattoo. I like to see them.
Yes.
No,
We'll work on that.
Yes.
Wonderful. So, yeah, for everybody that is here watching, please do look up Clinic Lefevre, right? Is that right, Lisa?
Yeah, that's correct.
And if you're in Amsterdam, or also go and see Nilce in the gender clinic there. Where is it exactly?
In Amsterdam.
In which hospital or which
hospital? VUMC, locatie Amsterdam. Yeah.
Fantastic. Thank you for sharing that. And we're really grateful for both of you to share your information today, and for Mace, who had to leave, but she was here very briefly, because she is happy with her results with the services offered through these two clinics, for the reduction improvement of scars after trauma or after surgery. So thank you for everybody for joining everybody, and please do stay tuned for upcoming events. And don't forget to like. Here's a button here, like, please follow, share our videos, share this playlist with your friends so they come back and watch some of the other interviews which we've had previously on all different topics for both patients and for professionals interested in learning more. So remember, everybody, what do I usually do? Remember your health and happiness.
Yeah.